All right, so today let's talk about something that you might not think about every day, your liver.
Ah, yes,
Specifically, fatty liver disease. Now, you might be thinking, wait a minute, my liver can get fatty.
it's true.
Yeah,
It's more common than you think.
it is. And it's
No.
definitely worth understanding
Mm,
because your liver is pretty crucial for, well,
mm,
living.
absolutely.
So, I recently came across this pamphlet from the Center for Digestive Health and Nutrition. It's really informative.
Oh, great.
And funny enough, I was listening to a completely different podcast. And they gave the center a shout out. They mentioned a stat that just blew my mind.
Yeah.
Over 25% of adult Americans have a fatty liver.
Wow.
That's a quarter of us
Yeah,
walking around with this condition, and many don't even know it.
it's a silent epidemic.
It is. So, before we get into the specifics of fatty liver disease, maybe we should take a step back and talk about the liver itself. It's a pretty amazing organ. Why is it so important?
Well, the liver's kind of like your body's central processing unit. It's doing so much all the time, over 500 vital functions. It makes bile to break down fats, filters out toxins from your blood, and it's even involved in regulating blood sugar and producing proteins. Pretty much anything you can think of, the liver has a hand in it.
Wow, 500 functions. That's a lot to keep track of. So, when we're talking about fatty liver disease, we're talking about having too much fat in the liver, right?
Yeah. Exactly. I mean, it's normal to have a little bit of fat in the liver. Everyone does. But when it gets to be more than 10% of the liver's weight, that's when we start to have problems. It's like imagine a sponge. A little water is fine, but if you soak it completely, it can't really absorb anything else.
Oh, that makes sense. So 10% is kind of the tipping point. Is that something that's pretty common then?
Unfortunately, yes. Studies are showing that over 25% of adults in the United States have fatty liver disease. And you know what's even more concerning? We're seeing it more often in kids too these days.
Wow, 25%. That is a lot higher than I would guessed.
Yeah, and actually, fatty liver disease is the leading cause of chronic liver disease in the US right now.
That's a bit alarming. So when we're talking about fatty liver disease, I know there are different types, right? Can you walk us through those?
You bet. We used to split it into two main categories: alcoholic fatty liver disease and non alcoholic fatty liver disease, NAFLD. But actually, just recently, in 2023, the name for NAFLD was updated to MAFLD, which stands for Metabolic Dysfunction Associated Fatty Liver Disease.
Oh, okay. So what's the difference between them and why the name change?
Well, the name kind of gives it away, right? Alcoholic fatty liver disease comes directly from drinking too much alcohol. It actually damages the liver, leading to that fat buildup. But MAFLD, what used to be called NAFLD, that's a bit more complex. It's got a lot to do with issues with your metabolism, kind of like a domino effect. Things like obesity, type 2 diabetes, and high cholesterol, those can all lead to MAFLD.
So it's not just about what you're drinking, it's about what's happening inside your body.
Exactly. And that's why they decided to change the name, to really highlight those underlying causes.
Makes sense. So MAFLD, it's really focused on what's going on metabolically. So those metabolic issues, like you mentioned, are those the main drivers of MAFLD? Can you break those down a bit more?
Sure. One of the biggest things is something called insulin resistance. Insulin is a hormone that helps your body use glucose, sugar, for energy. When you have insulin resistance, your cells don't respond to insulin as well as they should, and that can lead to high blood sugar.
Right, and high blood sugar, that's linked to diabetes.
Exactly. And it's also a factor in MAFLD because when your body isn't using glucose effectively, it starts storing it as fat. And some of that fat, guess where it ends up? The liver.
So it's like the liver becomes a storage unit for excess energy.
Exactly. You got it. On top of insulin resistance, you've got high triglycerides, which is a type of fat found in your blood, and of course, high cholesterol. All of those contribute to that fat building up in the liver.
So high blood sugar, high triglycerides, high cholesterol, all of that adds up.
Yep. And it's not just those things. Some medications can contribute, and even certain surgical procedures.
Wow, that is a lot of different factors. It sounds like MAFLD often comes along with other health issues then.
You're absolutely right. We often see MAFLD with other metabolic conditions like obesity and type 2 diabetes.
So it's important to look at the whole picture when we're talking about fatty liver disease.
Hmm.
We can't just look at the liver in isolation.
You're exactly right. Everything's connected.
Now, earlier you mentioned that fatty liver disease could progress to something called steatohepatitis. Can you tell us a bit more about that?
Sure. Steatohepatitis, that's basically like the next stage of fatty liver disease. And that's when things start to get a little more serious. Because now, along with the extra fat, you've also got inflammation and damage to the actual liver cells. Think of it this way. With simple fatty liver, it's like your liver is a bit cluttered. Harder to work, but it's still functioning. Steatohepatitis, it's like a fire broke out in your liver, causing real damage.
Okay, so the inflammation is a key difference here, and it sounds like it can cause some real problems down the line.
You got it. Steatohepatitis can lead to scarring of the liver, which is called fibrosis. And over time, if that scarring keeps getting worse, it can lead to cirrhosis.
And cirrhosis is a serious condition, isn't it?
It is. Cirrhosis means the liver's so scarred up that it can't do its job properly. And that can lead to all sorts of complications, even liver failure.
Wow, okay. So it sounds like early detection is really important.
Absolutely, but that's the tricky thing with fatty liver disease. In the early stages, it often doesn't cause any noticeable symptoms.
So you might not even know something is wrong until it's progressed quite a bit.
That's right. Which is why regular checkups and blood tests are so important, especially if you have any of those risk factors we've talked about.
We'll definitely dig more into the diagnosis and treatment in the next part of our deep dive. Is there anything else you want to highlight about how this condition progresses?
I think the most important thing to remember is that fatty liver disease, it's progressive. It doesn't happen overnight. It happens slowly over time. The good news is if we can catch it early and you're willing to make some changes to your lifestyle, we can really slow down or even reverse that progression.
That's great to hear. Well, we've got a lot more to unpack when it comes to recognizing and managing fatty liver disease. We'll be right back to continue our deep dive after a quick break.
Welcome back, everyone. So let's talk about how we figure out if someone has fatty liver disease and then, what we can do about it.
Okay, so we know that this isn't always something with obvious symptoms, at least not early on. So how do doctors usually go about diagnosing fatty liver disease?
Well, you're right. It can be a bit sneaky. That's why it's so important to have those regular checkups and blood tests. If a doctor thinks you might have fatty liver disease, they'll usually start with a blood test, specifically to check your liver enzymes. Those are proteins that your liver releases into your bloodstream.
So if your liver enzymes are high, that's a sign of a problem.
It can be, yeah. Elevated liver enzymes can definitely be a clue that something's up with your liver. Could be fatty liver disease, but, it's not a perfect test. There are other things that can cause those enzymes to be high too.
So it's like a little warning flag, but not a sure thing. So what happens next?
Well, usually the next step would be some imaging tests to get a better look at what's going on in the liver. An ultrasound is often the first choice. It's easy to do, doesn't involve any radiation or anything, and it can show us if the liver is enlarged or if it looks fatty. Sometimes we might use a CT scan or an MRI to get more detailed images.
So it's like we're looking at the liver under a microscope, but without actually having to do a biopsy.
That's a great way to put it. Those imaging tests can really help rule out other conditions and give us a better idea of how much fat is actually in the liver.
Okay, so we've got blood tests, imaging scans, anything else doctors use to diagnose fatty liver disease.
Sometimes, yeah. In some cases, we might need to do a liver biopsy. That's really to confirm the diagnosis and see how much damage there is.
You mentioned a liver biopsy earlier. Can you remind us what that is exactly?
Sure. A liver biopsy is basically where we take a tiny sample of the liver tissue using a thin needle. I know it sounds a little scary, but it's usually done with local anesthesia, and most people tolerate it really well. And that tissue sample, we look at it under a microscope to check for fat, inflammation, and scarring.
So it gives us a really up-close view of what's happening.
Exactly. It's like the gold standard for diagnosing and figuring out how advanced the fatty liver disease is, helps us decide the best way to treat it.
Okay, that makes sense. So let's talk about treatment now. We touched on lifestyle changes earlier, but can you break those down a bit more? What does that actually look like for someone with fatty liver disease?
Absolutely. So when we're talking about managing fatty liver disease, especially MAFLD, lifestyle changes are really the first line of defense. It's the most important thing you can do.
What are the biggest changes that people should focus on?
I'd say there are three main areas: managing your weight, your diet, and getting regular exercise. All of those play a role in improving your liver health.
Let's start with weight management. Why is that so crucial?
Well, think of it this way. If you're carrying around extra weight, it puts stress on your liver. By losing weight, even a little bit, you're taking some of that burden off and giving your liver a chance to heal.
So how much weight loss are we talking about?
Even losing 5 to 10% of your body weight can make a big difference in how much fat is in your liver and how well it functions.
That's good to know. It doesn't sound like you need to lose a ton of weight to see some benefits.
Nope, not at all. It's about making those changes that you can stick with, for the long haul.
So small steps can lead to big improvements for the liver. What about diet? What should people be eating or avoiding?
You know, the good news is you don't have to go on some crazy restrictive diet. It's really about focusing on whole, unprocessed foods and, limiting the things that can contribute to fat building up in the liver.
Like what kinds of foods?
I'd say cutting back on sugary drinks is a big one. Processed foods, too, saturated and trans fats. And those refined carbohydrates, like white bread and pasta, all of that stuff can contribute to weight gain and insulin resistance, which we know are big factors in MAFLD.
So it's really about making healthier choices in general.
You got it. And you know what? There are also foods that can actually help your liver.
Oh, like what?
Think fruits, vegetables, whole grains, lean protein, and healthy fats. All of those give you the nutrients and antioxidants your liver needs to stay healthy.
Okay, so making those shifts towards a healthier eating pattern overall. Got it. What about exercise? How did that factor into managing fatty liver disease?
Oh, exercise is huge. Good for your whole body, and your liver's no exception. When you exercise, you're helping your body use glucose for energy, which helps with insulin sensitivity, and that, in turn, can reduce how much fat gets stored in the liver.
So it helps your body use energy more efficiently, and that's good for the liver.
Exactly. And of course, exercise helps with weight loss, which we already talked about. Plus, all the other benefits of exercise, like feeling better, sleeping better, and less stress.
Sounds like a win-win. Now, are there any medications that can help with fatty liver disease? I know you mentioned there's no magic bullet, but are there any medications that can help along with lifestyle changes?
You're right. There's no medication that can just cure fatty liver disease. But there are some that can help manage the underlying conditions, the things that contribute to it. So, for example, if someone has type 2 diabetes, medications like metformin can help control their blood sugar, and that can indirectly benefit the liver.
So it's about addressing those interconnected issues.
Exactly. And if someone has high cholesterol, statins can help lower those levels, which can also help with fatty liver disease.
Okay, so it's kind of a multi-pronged approach then.
It is. And, even though lifestyle changes are the most important, there are some exciting new medications being developed.
Oh, that's good news. What are some of the things on the horizon?
One drug that's getting a lot of attention is called semaglutide. You might have heard of it under brand names like Ozempic and Wegovy.
Yeah, I've heard of those. Those are for weight loss and diabetes, right?
They are. But recent studies are showing that it might actually be helpful in reversing fatty liver disease. Even in people who don't have diabetes, it seems to reduce liver fat, the inflammation, and even some of the scarring.
Wow, that's amazing.
It is promising. But, it's still early days. We need more research. But it does give us some hope for new treatment options in the future.
That is definitely good news. Well, this has been incredibly helpful. We've learned a lot about diagnosing and treating fatty liver disease. I'm looking forward to diving into some of the newer research in the next part of our discussion. We'll be back in just a moment to wrap things up, so stay with us. Welcome back. So we've talked a lot about what fatty liver disease is, how it's diagnosed, and all the ways you can manage it. But, I think it's important to touch on something else, too, the emotional side of things.
Absolutely. It's not just about the physical effects, right? Any chronic health condition, fatty liver disease included, can really impact how you're feeling emotionally.
Yeah, it can be a lot to process, getting that diagnosis and realizing you need to make these big changes.
For sure. And it's okay to acknowledge those feelings. It's normal to feel some anxiety, maybe some fear. Some people even feel a sense of guilt or shame.
Right, like it's somehow your fault.
Exactly. But it's really important to remember this. Fatty liver disease is a medical condition. It's not a personal failing. It's not about blame. It's about understanding what's going on and then taking steps to manage it in a way that's good for both your body and your mind.
I like that. Be kind to yourself through this whole process.
Exactly. And remember, you're not alone in this. Fatty liver disease is really common, and there are a lot of resources out there to help you.
So what would you say to someone who's maybe feeling overwhelmed or struggling after getting this diagnosis?
First things first, don't be afraid to ask for help. Talk to your doctor, a therapist, or find a support group. Talking about how you're feeling can make a huge difference. And there's some great online resources, too, communities where you can connect with other people who get it.
Having that support system is so important. And what about making those lifestyle changes? I know they're key, but it can feel daunting.
Yeah, I get it. It's important to be kind to yourself here, too. Start with small changes, things you can actually stick with. Don't try to change everything at once.
Progress over perfection.
Exactly. Find those changes you can sustain over time. Celebrate those little wins, And don't beat yourself up if you have a setback. It happens.
Good advice. And, being informed is a big part of it too, right? The more you know about fatty liver disease, the better equipped you'll be to manage it.
Absolutely. Take charge of your health. Don't be afraid to ask your doctor questions, do your research, stay up to date on new treatments.
Well, this has been such an informative deep dive. We've covered so much about fatty liver disease today, from understanding what it is to how it's diagnosed and treated, and even some of the newest developments. Any final thoughts you'd like to leave our listeners with?
Just this. While fatty liver disease is a serious condition, it's often preventable and manageable. The key is knowing the risks, getting checked regularly, and making those healthy lifestyle choices. And remember, if you need support, reach out. And before we sign off, I want to give another shout out to the Center for Digestive Health and Nutrition. Their website is an amazing resource for anyone who wants to learn more about digestive health, with tons of information, articles, it's all there.
So big thanks to them for all the great work they do.
Yes, thank you.
Great advice. Thank you so much for sharing your expertise with us today. And to all of you listening, thanks for joining us on this deep dive. We hope you found it helpful and empowering. Remember, knowledge is power when it comes to your health. Be sure to check out the other resources on our website. And until next time, take care.